An intensive care nurse has told of the final moments she spent with a dying coronavirus patient and how she held her hands until she passed away. Juanita Nitla, 42, has revealed how she watched the heart rate hit zero and saw the patient flatline as music requested by the family played in the background and the patient's daughter listened on the phone. The senior sister, who has been working with critically ill COVID-19 victims at the Royal Free Hospital in Hampstead, North London, said she then gave the patient a bed bath, wrapped her in a white shroud, put a sign of the cross on her forehead before placing her in a body bag. Ms. Nitla says she is unable to sleep as she thinks about those that have died in her care and feels responsible for someone's death when even the support provided by the ventilators cannot save their life. In the heartbreaking account from the coronavirus frontline, Ms. Nitla told the BBC how she saw a nurse in her 50s lose her battle with the infection. She told how the patient looked very comfortable before closing the curtains on the 8-bed ward and turning off the alarms. Music requested by the family was played as medical staff fell silent, and Ms. Nitla then placed the phone next to the patient's ear, asking the daughter to speak as the support provided by the ventilator was withdrawn. She said, "I saw flashing lights on the monitor and the heart rate hit zero, flat line, on the screen. I stood beside her, holding her hands until she passed away." Ms. Nitla then disconnected the tubes providing sedation drugs, and heard the patient's daughter still talking to her mother. She took the handset and told her she had died. The patient passed away less than 5 minutes after Ms. Nitla started to turn off the ventilator. She added, "With the help of a colleague, I gave her a bed bath and wrapped her in a white shroud and placed her in a body bag. I put a sign of the cross on her forehead before closing the bag." Ventilators take over the body's breathing process after coronavirus has caused the lungs to fail. However, for some seriously ill patients, the support from the breathing machine is not enough, and doctors have to make the tough decision on whether to withdraw treatment. The gradual process involves removing the drugs and oxygen the patient is receiving until they flatline, after which the tubes are withdrawn. Speaking about how she deals with the trauma, Ms. Nitla told the BBC, "It is daunting. I do have nightmares. Sometimes I feel like I am somewhat responsible for someone's death." Ms. Nitla, who has reduced lung capacity after suffering from tuberculosis last year, said, "I put everything aside and do my job. At the end of my shift I do think of the patients who died in my care, but I try to switch off when I step outside of the hospital." Due to a massive surge in the number of admissions, the hospital's critical care unit has expanded from 34 to 60 beds. Ms. Nitla added, "Before the start of the shift we hold our hands together and say, 'Stay safe.' We keep an eye on each other. We make sure everyone is wearing the gloves, masks, and protective gear properly." Since speaking to the BBC, Ms. Nitla has been asked by the hospital to remain at home, due to her underlying health condition. It has emerged that the number of health and social care workers to have died of coronavirus has surpassed 100 in the UK. Doctors, nurses, care home workers and allied healthcare professionals have all been lost in Britain's fight against COVID-19. The government has only confirmed the death of 27 NHS workers, but the nursing platform Nursing Notes says the number was at least 106 by this morning. Its records show Black, Asian, and minority ethnic people accounted for 75% of healthcare workers' deaths, despite them only being 20% of the workforce. In separate figures released today, it emerged that the true number of coronavirus victims in the UK may still be 41% higher than daily government statistics are letting on. Weekly data published today by the Office for National Statistics showed that at least 13,121 people had died in England and Wales by April 10. Department of Health Statistics had, by that date, announced only 9,288 fatalities. The backdated deaths increased the total by 41.2%. That suggests the death toll of 16,509 confirmed yesterday could, in reality, be closer to 23,000. and care homes in England and Wales had recorded the deaths of at least 1,644 residents by April 10% of all the UK's COVID-19 deaths. Today's update is one of the first real official glimpses of the crisis gripping the care sector. 15% of all people dying with COVID-19 were succumbing to their illness outside of hospitals, the stats showed, revealing the crisis cannot be managed solely by the NHS. And 1 in every 3 people who died of any cause between April 4 and April 10 had coronavirus. That week, authorities recorded the most deaths for a single week in 20 years, with 18,516 people dying, 8,000 more than average. Around 6,200 of those were officially linked to the coronavirus, suggesting a further 1,800 were indirect excess deaths or COVID-19 sufferers who never got tested. Thank you for watching our video. Please show your support by subscribing to our channel and turn on the notification. Follow us on Twitter, Instagram, Facebook and Reddit for more videos.